important video for all the women who have young girls who are ready to attain puberty or attained puberty and don't know how to guide them. Here's a little tip for you. Very important thing is that this is a physical process that happens every month, and it's important that we educate young girls about what can happen before, during and after. So it's easier to deal with periods because it's physical, it is visualized, so you can see what's happening and you can advise them accordingly. So definitely I understand that most of you would have had the chat to your young women. If not, please do so. But what happens to the psychological symptoms? As you know, menstrual cycles are associated with constant hormonal changes. So there are times when the girls or young women are pretty happy, chilled, cool, and then they become a nightmare to everybody around them, isn't it? It's a daily thing that most girls experience. But if we educate them appropriately, it helps them understand their own emotions, so it does not affect their day-to-day life, and also helps other people around them understand that why these changes are happening. So what are these changes that contribute to what we call premenstrual syndrome? So common things could be mood changes, irritability, cravings, or subtle alterations in weight. So these are all very, very common, but generally they start maybe 3 to 4 days prior to the onset of the period. It gets worse. Of course, pelvic pain may be there, and then it can get worse and it gets better as soon as the period is finished and back to the normal self. So yes, it can be cyclical, so almost like a predictor for the onset of the menstrual cycle. So it's really important that once you recognize yourself, then you understand, okay, this is the hormonal changes that are causing the trouble. It's not you ruining your diet or exercise plan or anything like that. So even though the woman is experiencing or the girl is experiencing such symptoms, it's only temporary. It is not impacting the lifestyle. But if this starts to affect in a greater degree, so there's associated depression, anxiety, sleeplessness or insomnia, it's beginning to affect the quality of life of this young woman, then it's called premenstrual dysphoric disorder. So it's really important that we differentiate the two, and if this is something that you are worried about or that you suspect you could be having, then please speak to your own healthcare professional. How do you differentiate if you're struggling with PMS or PMDD? I'm just going to give you a small exercise that you can do it yourself at home, and then you can decide if this is something that you need to look into further and talk to your healthcare professional. So these are the symptoms that I'm going to list soon. In these symptoms, score them on a scale of 1 to 3, 1 being low and 3 being the worst. Okay, are you ready? So the first symptom is anxiety, second symptom is depression, or third symptom, mood swings, fourth symptom, breast tenderness, fifth symptom, fatigue, sixth symptoms, cravings, 7 is insomnia, and the last one is headache. So you can sit down, score it, and of course if the score is only 1 for all of them, then it's mostly PMS, but you should have scored 0 for anxiety and depression. That's really important. But if you have scored 1 for anxiety, depression, and any more than 1 for rest of the symptoms, that means you've got premenstrual dysphoric disorder. So that's the main difference between the two. And premenstrual dysphoric disorder becomes severe and affects a young girl's day-to-day life. So definitely seek help. Don't let it go. There is no need to suffer if you do have the option to look after yourself and feel better about it. So please go ahead and speak to your own healthcare professional, or if you'd like to make an appointment to come and discuss it with us, you can book yourself through www.athenawomensclinic.com.au. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. Thank you for watching the video. So once you have self-diagnosed and reach the point that if it is PMS or PMDD, what can you do to yourself? So self-care tips for yourself before you go ahead and make a formal appointment with your healthcare professional, or while you're waiting to see your own healthcare professional. Basic things: Avoiding stress. First things first, avoiding stress. How is important? You can do some breathing techniques, yoga, which will all increase your serotonin level to help reduce your stress. Second thing that you can do, exercise. So minimum of 30 minutes of aerobic exercises, whatever you're comfortable with, but that's what's really important, to do it on a consistent basis. Again, consistent basis, really important. Avoiding caffeine, alcohol, high sugar content in your diet. Again, really, really important that you follow this, especially leading up to the premenstrual phase and to your menstrual cycle. It is important. Yes, availability of these foods, it will be there all around you, so you will be very tempted to go ahead and eat them. So this is a test for your own self-control as well. So it's really important that you make sure that you stock alternate healthy products around you, so you can reach out for them when the cravings really hit. And last things I want to say, don't jump on the scales and then worry too much about it. As we know, there's lots of day-to-day variations, weekly variations, monthly variations in the weight. So don't be overtly dependent on scales and get depressed about the weight. Overall, if you're able to manage and keep your weight steady, but focus on eating healthy, yoga, meditation, exercise, the outcomes are much better. So all the best with your journey in regards to this. Thank you.